During the coming months and through the remainder of the session, we will examine important topics that span the entire range of the federal programs meant to serve our nation's veterans. The subcommittee will at times delve into some arcane topics. At other times, we may stir some controversy even. But the subcommittee will likely reveal failings of the Department of Veterans Affairs and also show where the VA is heading in the right direction. We will also find examples where Congress must take action, whether to update and correct current laws or require better accountability from federal agencies and officials. However, all the subcommittee's work will have a central goal: ensuring the nation provides the support we need to give it to our veterans who earned it, the men and women who served our nation at home and abroad. Today's hearings will review the work of two independent and nonpartisan government agencies that have a long history in oversight of the Department of Veterans Affairs. Both the Government Accountability Office and the Department's Office of Inspector General regularly identify key concerns about VA operations, and each year, hundreds of reports are issued that recommend improvements. Their work is critical for the Department, for Congress, and for the public to understand the workings, the needs, and at times the shortcomings of the VA. Of course, it is ultimately up to the VA to implement the recommendations GAO and the IG make, but it does not always do so in a timely manner. For example, some of the GAO priority recommendations have remained unimplemented since 2012. The VA healthcare system has been on GAO's high-risk list since 2015, and the Department still has not developed a viable action plan for getting off that list. GAO has added a second VA operational area, acquisition management, to its high-risk list this year. The Inspector General has more than 500 recommendations that VA still needs to implement, and about a quarter of those have been awaiting implementation for more than a year. Through their oversight work, GAO and the VA Inspector General repeatedly find systemic weaknesses at the VA, such as poor governance structures, a lack of leadership continuity, and failure to communicate effectively. These problems translate into real risks for veterans. For example, just last fall, GAO found that a lack of consistent program leadership resulted in VA spending only about 23% of the $6.5 million allocated for suicide prevention outreach during fiscal year 2018. As part of their testimony, the witnesses will describe the importance of strong and consistent leadership to ensure recommendations are implemented and major management challenges are addressed. Unfortunately, a key witness is missing today, and that's represented by the chair that is empty. Secretary Wilkie of the Department of Veterans Affairs declined our invitation, and he elected not to arrange for a representative of the department to come in his place. The Secretary did not offer any scheduling conflicts or other credible reasons for why he decided not to participate. Rather, he seemed to feel it would not be in his or the department's best interest to share a panel with our two oversight witnesses who are here with us today. Frankly, I find the VA's absence unacceptable. Contrary to what the Secretary claimed in his communications with Chairman Takano and Ranking Member Rowe when declining to participate in the hearing, House Veterans Affairs Committee has had a long history of seating the VA witnesses on panels with witnesses from the GAO and the IG. This is also quite common across other congressional committees. One question I had planned to ask the Secretary today was whether he considers addressing the audits, the examinations, and the recommendations of the GAO and the IG to be a high priority, and whether these findings have helped shape his leadership of the department. The department's refusal to participate in today's hearing speaks volumes about the degree to which it values the insights and recommendations that Mr. Dodaro and Mr. Missel have to offer. It's my sincere hope that the Secretary will soon come to the conclusion that the VA cannot go it alone. And to be clear, this subcommittee invited the Secretary to appear today in order to allow for greater dialogue and discussion on this critical path forward. Congress is at its best when it invites those of differing views to share their analysis and opinions, even when they strongly disagree, so we can endeavor to find the best solutions to the problems faced by our nation and our veterans. With that, I would like to recognize Ranking Member Bergman for 5 minutes for any opening remarks he may wish to make here today. General Bergman.
Thank you, Mr. Chairman, and congratulations on holding your first hearing as chairman of the O&I subcommittee. Historically, and especially last term, it was a very bipartisan subcommittee focused on asking tough questions and getting good results in dialogue, not only from the likes of, you know, GAO and the IG, but the VA as well. We're here today to understand how the Department of Veterans Affairs responds to recommendations of the VA Inspector General and the Government Accountability Office. In an organization as large and complex as VA, there will be challenges and there will be problems. and sometimes the people who are responsible need to be held accountable for the good of the organization. Other times, challenges and problems are more systemic. In either case, a good measure of leadership and organizational health is an agency's response to these challenges. Unfortunately, VA is not participating in today's hearing. It has not been the recent past practice of the committee to invite the Secretary to testify at a subcommittee hearing. Additionally, we generally place the Secretary on a panel of his own out of deference. I understand that attempts were made to accommodate the agency, but in the end, compromise could not be reached. I hope that in the future we can overcome these issues because we need to hear from the VA to fully understand the issues. We are fortunate, however, to have the Comptroller General and the VA Inspector General here today representing their organizations, which are working day in and day out to improve VA's effectiveness and efficiency. Comptroller General Dodaro, Inspector General Missel, thank you for being here. Your organizations provide a valuable service to VA and the men and women who rely on VA for benefits and health care. My interest today is on what happens after the GAO or the IG issue recommendations in their reports. What procedures are in place at VA to ensure timely and proper implementation of recommendations, and how does GAO and the IG help VA close recommendations? I'm also interested in understanding who at VA is accountable for monitoring implementation of GAO and IG recommendations across the department, and what happens when the process for closing those recommendations stalls. As you know, the Department of Veterans Affairs Office Accountability and Whistleblower Protection Act of 2017 created the Office of Accountability and Whistleblower Protection and tasked it with responsibility for recording, tracking, reviewing, and confirming implementation of recommendations. It is clear from VA's statement that the OAWP is not performing those functions as of yet. So I would appreciate our witnesses' ideas on how OAWP can improve this state of affairs. I'm also interested in hearing from the Comptroller General what he sees as best practices and how other agencies developed and executed successful work plans to work their way off the high-risk list. Again, it is unfortunate that VA is not here today because it appears that there are good facts for VA to highlight. According to the data on the Inspector General's website, VA has closed approximately 94% of the over 8,600 recommendations issued by the IG since October of 2012. Additionally, of the 510 open recommendations, only 123, or less than 1.5% of all recommendations, are over 1 year old. Similarly, according to the GAO's Priority Open Recommendation Letter, dated March 28, 2019, VA had implemented 90% of GAO's recommendations issued within the last 4 years, which is higher than the government-wide average of 77% and 10% above GAO's target of 80%. This is not to say that the VA is perfect, but it suggests that in recent years, VA is trending in the right direction. The question now is whether VA is properly addressing the highest priority recommendations and what barriers, if any, exist to closing them out. I look forward to a constructive hearing as we look for opportunities to improve how VA responds to GAO and IG recommendations. With that, Mr. Chairman, I yield back.
Thank you very much, General Bergman. I look forward as well to working with you over this term. I will now recognize our first witness, Mr. Gene Dodaro, Comptroller General of the United States and head of the Government Accountability Office. Mr. Dodaro was confirmed by the Senate in his role in 2010 and is serving a 15-year term, but his career at the GAO goes back 45 years. His agency produces hundreds of reports each year, leading to billions of dollars of savings by federal agencies and important improvement to agencies and programs. The subcommittee thanks you for appearing today, and Mr. Dodaro, you have 5 minutes.
Thank you very much, Mr. Chairman. Good afternoon to you, Ranking Member General Bergman, Congressman Bost, Cisneros, and Rose. It's very nice to see all of you here this afternoon. I want to highlight the fact that our work at the VA has shown that there are many dedicated and talented people that are working very diligently to try to serve our veterans. However, the agency is seriously hobbled by underlying fundamental management weaknesses that make it very difficult for them to implement management reforms. Now, in order to highlight the attention of the administration and the Congress to these areas, I've placed a number of VA management issues on our high-risk list. In 2015, we added managing risk and improving health care to the list due to ambiguous policies and procedures, inadequate oversight and accountability, information technology challenges, inadequate training, and unclear resource needs and allocations. This past March, when we update the high-risk list, which we do across government, at the beginning of each new Congress, we added the acquisition management area at VA to the list as well. Here again, add outdated policies and procedures. They haven't been updated in over 10 years. There was not a very good, effective strategy for medical and surgical procurements that were in place. Contract managers, management staff were overworked. In a lot of cases, wasn't adequate training, and so these areas were problematic. Now, in 2003, we also added across the federal government managing disability programs. Now, one of the most significant disability programs, in addition to the Social Security Administration, is at VA. And so there were concerns with processing of initial claims as well as appeals and backlogs and timeliness, as well as updating the eligibility criteria, which hasn't been updated in decades, despite efforts on the part of the Veterans Administration. So these are very, serious management problems. And I would make the point, though, that while implementation of our recommendations is an appropriate benchmark to use, it really is not going to be sufficient alone to solve VA's underlying management weaknesses and get off the high-risk list. The criteria for getting off the list is leadership commitment that's sustained, the fact that they have the capacity, the resources, and the people. Very importantly, there needs to be a corrective action plan that deals with the underlying root causes of the problems. And there needs to be a monitoring effort with milestones and metrics to be able to gauge progress, and there needs to be actually some demonstrated progress in fixing the problems. The reason I put things on the high-risk list, and these are the highest risk management risks across the federal government. There are 35 areas on the list. The reason I put it on there is because we can make recommendations, VA can address them, but we then make new recommendations that are still dealing with the same underlying problems. And that's the pattern we're in with the Veterans Administration. And so just addressing our recommendations isn't going to deal with the underlying management weaknesses there. I think the department recognizes this and is embarking at the VHA on a modernization program that has 10 lines of effort and is trying to put things in place. VA has come to the Congress to get legislation to modernize its disability claims processes and implementing those reforms right now. But in order for these reforms to be successful, VA leaders are going to have to energize an entrenched bureaucracy that's challenged in implementing successfully management reforms. Now, GAO is very dedicated to working with the department in order to help it achieve success, and I'm happy to share in the Q&A our experiences with other agencies. 26 areas have come off the high-risk list over time. There's a prescription for success here. I've discussed this prescription with the Veterans Administration, and we're trying to work with them to implement it there as well. But we're not there yet. And so I look forward to taking questions from you at the appropriate time.
Thank you, Mr. Dodaro. I would now like to recognize Mr. Michael Missel, Inspector General of the Department of Veterans Affairs. Mr. Missel was confirmed by the Senate in his role in 2016. He has had previous experience in both the private sector and at other government agencies, including the Securities and Exchange Commission. The Office of Inspector General conducts investigations, audits, evaluations, and inspections of VA programs to eliminate waste and fraud, as well as to detect and prevent criminal activity. The subcommittee thanks you for appearing today, Mr. Missel. You have 5 minutes.
Thank you. Chairman Pappas, Ranking Member Bergman, Chairman Takano, and members of the subcommittee. As we approach Memorial Day, the Office of Inspector General honors the men and women who have laid down their lives in defense of our country. At the outset, I want to express our appreciation for the work of this subcommittee on behalf of veterans. I thank you for the opportunity to discuss recommendations issued by the OAG that assist VA in improving services and benefits to veterans and their families and caregivers. I also appreciate testifying with Mr. Dodaro as we work closely together to ensure coordination and avoid duplication on our respective oversight responsibilities. OIG recommendations are directed at every level of VA operations. They affect the quality and access to health care for veterans and benefits for veterans with disabilities, their caregivers, and family members, and the effective stewardship of VA's approximately $200 billion budget. OIG reports focus not only on solutions to a defined problem, but also identify the underlying root causes of issues that negatively impact current programs and future initiatives. As a result, these recommendations may also be a roadmap that other facilities, offices, or programs can follow to apply any lessons learned across VA and to take corrective actions applicable to other relevant VA operations. Our critical work could not be accomplished without congressional support of OIG efforts through its appropriations and the attention given to OIG reports and recommendations. The OIG looks forward to working with our many stakeholders to advance recommendations for improvement in all VA programs, services, and systems. This includes recommendations proposed in the 100 reports issued during the first half of fiscal year 2019. When developing recommendations, we focus on several key principles, including the following. First, recommendations are directed to the specific VA office or program official that has the responsibility and authority required to implement them. While our recommendations may be narrowly addressed to a particular VA facility or operation, VA should be disseminating information about identified problems and remediation plans to officials in all VA offices that could potentially have the same issues and are positioned to take positive action. We meet often with senior leaders and other VA staff to discuss specific issues and trends we identify in our work. Second, recommendations are current with ongoing issues and, except in rare circumstances, should not require more than 1 year to implement from the report's publication. This helps minimize the risk that OIG recommendations languish, become outdated, or lag behind VA policy and program changes. Third, OIG recommendations are objective and driven by all documentation and other information collected and analyzed in accordance with audit, inspection, review, and investigative standards. Finally, while we make recommendations, we do not direct how they are executed. It is important to note that OIG staff cannot mandate that VA accept OIG recommendations or, pursuant to federal law, direct specific action to carry them out. Consistent with this limitation, OIG reports may contain recommendations for VA to take appropriate administrative action against a specific VA employee for misconduct, but VA leaders and managers are then responsible for determining any appropriate administrative action. As of the last reporting period, there were 84 OIG reports and 403 recommendations that had been open less than 1 year. The total monetary benefit associated with these recommendations is more than $2.7 billion. There were also 40 reports and 133 recommendations that remained open for more than 1 year. The total monetary benefit related to these reports is more than $329 million. The OIG is deeply committed to serving veterans and the public by conducting effective oversight of VA programs and operations through independent audits, inspections, review, and investigations. That commitment can only be realized by making practical, meaningful recommendations that enhance VA's programs and operations, as well as prevent and address fraud, waste, and abuse. Mr. Chairman, this concludes my statement. I'm happy to answer any questions that you or other members of the subcommittee may have.
Well, thank you very much, Mr. Missel, for your testimony. I would like to now recognize the chairman of the full committee, Chairman Takano, who has joined us for this first hearing of our subcommittee. If there are no objections, I recognize Chairman Takano for 5 minutes.
Thank you, Chairman Pappas and Ranking Member Bergman. I came to today's hearing for two important reasons. First, I wanted to note that this is the first hearing of the session for the Subcommittee on Oversight and Investigations. The subcommittee has a long and successful history of reviewing issues of great importance to our nation's veterans. Past hearings have examined concerns with veterans' health care, delved into major problems with agency contracts, and reviewed whether the department's money is well spent. I know that Chairman Pappas, Ranking Member Bergman, and the rest of the subcommittee will move forward with sharp eyes and an even-handed approach as it examines the gamut of issues and challenges facing the department. The best oversight is conducted with a nonpartisan approach based on evidence and facts. The Comptroller General and VA Inspector General are here today to help us understand the evidence and facts, and I want to welcome them too. Welcome, gentlemen. However, I also must note that we have an empty chair at the witness table. The Department of Veterans Affairs decided not to show up for the hearing today. This is unacceptable. By not appearing today, the VA Secretary is ignoring an opportunity to show that the Department cares about addressing the serious concerns GAO and the IG have identified. The Veterans Health Administration and VA contracting are both at high risk, according to the Government Accountability Office. The Comptroller General is here to testify about needed action by the Department. We need to hear from VA leadership about their plan to be removed from the Department, to be removed from the Department's, from the high-risk list. The VA Inspector General is here to testify about the 510 recommendations totaling approximately $3 billion that have not been yet implemented by the Department. These include recommendations to address medical supply chain failures that have had at times led to delayed procedures at the DC VA Medical Center. Other recommendations focus on inappropriate denial of claims for veterans who experience military sexual trauma. The IG is also here to discuss its work on how VA can and should improve its suicide prevention programs and the Veterans Crisis Line. It is Congress's constitutional duty, and I say that again, it is Congress's constitutional duty to oversee the federal government. This committee will not abandon its duty to protect the interests of veterans, their families, and taxpayers. Now, the Secretary wrote to me and Ranking Member Phil Rowe stating that participating on a panel with the Department's watchdogs was somehow a break with tradition or practice. Frankly, this is a terrible excuse. VA doesn't get to pick and choose which hearings they'll attend. His refusal to show up sends Congress the wrong message. Instead, we need to hear that VA will address the concerns identified by independent, credible investigators and auditors. The Department and the committee have a history of working cooperatively with each other. I expect VA to show up and be accountable for the next hearings of the committee. I look forward to the hearings and other work that the subcommittee will undertake in this session of Congress. And with the remaining time, I do want to ask a question for Mr. Missel of the VA OIG. Mr. Missel, your testimony discussed some important work by your office regarding the prevention of suicides. As you know, it is the #1 priority for this committee. It is a continuing tragedy that on average 20 veterans commit suicide each day. I understand that the Office of Inspector General released a report on March 2017 that examined the VA's Veterans Crisis Line. The report revealed many serious problems with the crisis line, substantially impacting the quality of response to veterans' needs. 16 recommendations followed on a range of issues, such as improved crisis line staff training, more modern technology, and better cooperation with the VA Office of Suicide Prevention. Mr. Missel, did VA implement all of those recommendations, and how timely was VA's response?
Chairman Takano, I believe all those recommendations are now closed out. We share the seriousness of suicide. We have a number of different active projects on it right now. And in fact, with respect to the Veterans Crisis Line, we put out a report in 2016, followed that up with one in 2017, and we recently went back just to ensure that it's operating as effectively as possible, given how many veterans it touches.
Well, thank you very much, and I yield back, Mr. Chairman.
Thank you very much, Chair Takano. And since we're on to the question portion of the subcommittee hearing, I'd like to recognize myself for 5 minutes. It's noteworthy that both of our witnesses here today understand the importance of strong and consistent leadership for ensuring that major problems are addressed and that the recommendations are ultimately implemented. Unfortunately, the VA faces a major challenge. Currently, too many top positions remain unfilled at hospitals and within VA headquarters itself. Further, many of the leadership positions are filled with people serving in an acting capacity. The subcommittee staff has analyzed some data regarding leadership instability within the Veterans Health Administration, which is charged with taking care of the health care needs of more than 9 million veterans across this country. A few charts here today. Chart number 1 here behind me shows that during the past 5 years, the Veterans Health Administration has gone for a total of 824 days without a confirmed leader. Dr. Richard Stone is currently leading the VHA in an acting capacity. Also behind me, we found that 48% of senior leadership positions within the Veterans Health Administration are currently held by individuals serving in an acting or an interim role. In addition to that, the Veterans Health Administration has been affected by turnover in the position of the VA's Chief Information Officer. Since January 2017 alone, 4 different individuals have led the VA's Office of Information Technology. With a significant number of major IT projects in the works for the VHA, this level of top leadership turnover has presented numerous risks to the successful completion of those very projects. I know that Dr. Stone and the vast majority of VA and VHA leaders, even those serving in an acting capacity, are working really hard and are very dedicated to serving our veterans. However, a lack of permanence when leaders are at times wearing multiple hats within the agency, dividing their attention between key management responsibilities, is hardly the best situation for ensuring quality care. So for both witnesses, Inspector General Missel and Comptroller Dodaro, do these charts point to a major problem for the VA, and do these leadership problems challenge the ability for the department to address your recommendations?
I agree that they present major challenges for VA. Continuity of leadership is a key issue. Leadership sets a tone at the top. VA is a very large, complex organization. It takes anyone a significant amount of time to really understand the program's operations and culture. In addition, when you have somebody in an acting position, they don't have the authority or the support of many of the staff that they're going to be able to move a program or initiative forward. And so we have found that in many situations, leadership has been a key issue that has caused or has resulted in some of the problems.
I agree with Mr. Missel. And actually, I was about ready to downgrade the Veterans Health Administration and the healthcare area in our rating on leadership commitment to not met at all. And I kept that it partially met based upon a conversation I had with Secretary Wilkie. I'm giving him the benefit of the doubt, and I've had a lot of follow-up with Dr. Stone as well. But this is a serious problem, and there needs to be sustained leadership at the VA. I've met with each of the last 4 secretaries. They've all had different priorities and initiatives that have taken the department in somewhat different directions and kept it from having sustained leadership. One of the reasons I put things on the high-risk list is that most of the problems need to be addressed across multiple administrations. These are the hardest management problems in the government. And in order to have them succeed, there have to be plans in place that sustain it across a period of time. And it's difficult to do it with a lot of turnover and with a lot of lack of sustained leadership.
Well, thank you for that response. Mr. Comptroller, looking at a parallel example in a different agency, the Department of Homeland Security was unable to pass a major financial audit. Among other things, this led it to be included on the department's high-risk list. And I'm wondering if you could talk a little bit about what happened in that case and what DHS has done to address its high-risk designation and what it might hold for the VA.
Yes. We designated the Department of Homeland Security a high-risk area at the day it was stood up and created back in 2003. They've made a lot of progress over a period of time. I've met with a lot of secretaries, deputy secretaries, and other key officials over there. And in the early days, it was difficult to see a lot of progress, but eventually they became more engaged with us. And then what we did agree, though, is several years ago on 30 outcomes that we were going to gauge them on as to whether or not they were going to be successful or not. So we both agreed on what outcomes we were trying to achieve in this area. I just reported March 17 of the 30 areas they have met now and are on their way. One of them is for 4 years running now. They've got a clean opinion on their financial audit, which they hadn't for many years previously. And most of the other areas, they're on their way to make some progress. Now, they still have, significant issues, particularly in getting more modern financial management systems and their acquisition procedures. And so they still have issues, which is why they're still on the list. But we have a plan. Now, that plan has remained the same with changes in administration over time because we've agreed on it. We meet on a regular basis, on a quarterly basis. The Department of Homeland Security rates themselves against the criteria we have for coming off the list. We review it, and then we respond to them and their efforts. So we have a very constructive working relationship over there. Now, of course, they have some vacancies now themselves, and but I'm hoping to continue to work with them. I just testified a few weeks ago, and Congressman Rose is on that committee. On the management challenges at the Department of Homeland Security. But I've mentioned to the VA that that's a good model, and that's what we're trying to work toward both with VHA and with VBA. And so I'm hopeful that we can take those success factors. Now, the other important thing that I want to emphasize, hardly any area in the high-risk area gets off the list without sustained congressional oversight as well and action by the Congress. I mean, the engagement by the Congress is absolutely critical to the success of agencies coming off the high-risk list. So I would encourage this committee to remain focused on that and to continue to work to ensure they're addressing these fundamental management weaknesses, because otherwise the efforts will keep repeating themselves. And there'll be serious problems with any reform that needs to be implemented.
Sure. Thank you, sir. I would now like to turn it over to General Bergman, the ranking member, for 5 minutes.
Thank you, Mr. Chairman, and both Mr. Dodaro and Mr. Missel, you used the term symptoms versus root causes. I'm glad to hear you say that, because we can waste a lot of time dealing with symptoms, and unless we deal with the root causes, and we're not going to get the results that we know we need. And Mr. Dodaro, you said VA is hobbled by fundamental management weaknesses. Is one of those weaknesses the inability to identify root causes versus symptoms?
That's part of it. I mean, we had a difficult time getting VA to do root cause analysis a few years ago, for example, when we put the healthcare area on the list. But eventually they came to a list of root causes, and I outlined what those were that they identified themselves, and they comport with a lot of what we identify as
Okay, so we actually, they were able to...
They were able to come up with the root cause. What they haven't been able to do, though, is translate that into an action plan to deal with the root causes that have metrics and milestones and clear accountability and a lot of other, fundamental.
So I hate because
Yeah.
I know we are on the same wavelength here, and Mr. Missel, you mentioned that GAO can recommend but not require. Is that correct?
Our office can
Yes.
recommend, but not
Yeah, so the
require.
point is, as we then go back and forth between what you're both articulating, this is pretty much the same question for both of you. Would you please explain how your office and the VA collaborate to close recommendations, and who within VA is responsible for facilitating that collaboration?
We have a very active program on outstanding recommendations. So once a recommendation has been published in a report, we review them quarterly with VA to see what progress they're making. We expect to get in writing the progress that they've made, and we continue that throughout until the recommendation is closed. The responsible person would be the person to whom the recommendation is addressed. All of our recommendations are addressed to an individual, whether it's the secretary, deputy secretary, or on down from there.
Okay, Mr. Dodaro?
Yeah, we coordinate through their Office of Congressional Liaison, and that individual then has us work with the individual officials that are responsible for the area. So, for example, at the Veterans Health Administration, our people meet with them on a monthly basis. We go over the recommendations every 4 to 6 weeks, and to deal with them. Then we deal with VBA separately. So we have regular meetings with them to both help them understand what they need to do to implement the recommendation, and very specifically answer any questions they have, and then make it clear that, like, we'll make a recommendation that something will be fixed. They'll come up with a plan to fix it and want us to close the recommendation. We'll say, no. It takes more than a plan. You actually have to implement the plan, and you have to deal with this issue. So those are the kind of conversations that we have with them in order to do that. I think we have an effective process working with them to close these recommendations. But again,
I see my time is
Yeah,
running out here,
okay.
but Mr. Dodaro, I got one more here for you. About roughly 26 areas have been removed from the high-risk list. Some areas were removed in as little as 3 years, while one took 29 years. What are the top 3 best practices that GAO has found effective in helping agencies address high-risk concerns?
one is, number one is an effective action plan that deals with root causes, as the metrics, milestones. You need a roadmap, and you need to evaluate how well you're getting there in achieving those objectives and dealing with these underlying root causes. That has not been done at VA in any of the areas we've designated them on the high-risk list yet. So number 2 is sustained congressional leadership. There needs to be buy-in from the leadership at the top and at all levels. And that leadership has to engage with GAO, but importantly, send the proper messages to their agencies. Number 3 is congressional engagement in this process. Congress has to be is a key stakeholder in the process, not only from an oversight standpoint, but also to make sure that whatever VA needs to implement these actions, that Congress is willing to provide. Those are the top 3.
Okay. I yield back.
Thank you, General Bergman. I now recognize Mr. Cisneros for 5 minutes.
Good afternoon, gentlemen. Thank you for being here. Mr. Dodaro, in adding VA's acquisition management to the high risk last year, the GAO cited evidence from its September 2018 report on the Veterans First program, which requires VA to give preference to veteran-owned small businesses when awarding contracts. Among other things, GAO found the VA training lacked clarity on how contracting officers should balance the preference for veteran-owned small businesses with fair and reasonable price determination when lower prices might be found on the open market. In addition, GAO found that the VA's online training sessions on the Veterans First policy were not mandatory, so only about 52% of VA contracting officers had completed the training. You recommended that the VA design more targeted training and consider making it mandatory. Can you tell me about the extent to which the VA has implemented this recommendation?
Yeah, first, the VA has clarified the guidance to contracting officers to have them document the determinations that they make, and they're actually doing some compliance checks now to make sure that that new policy is being implemented effectively. They are moving toward making the training mandatory and then providing it to all people. That hasn't fully happened yet, but they're on their way to having that accomplished.
So this is, I guess, some of the problems that we're seeing, right, when you talk about the management weakness. I mean, how difficult is it to make a mandatory training? It seems like it should be something that could be done with a simple letter.
At GAO, I make that decision. I make it right away. So it's important. I mean, they should be able to do this, but they also have to work with their union and all the union bargaining agreements and how the training would be provided, and so that may take some time.
Mr. Missel, you had said that you cannot implement the, and this is just to kind of really follow up on some of General Bergman's questions, but you said you can make recommendations, but you can't make the VA implement these recommendations.
That's correct.
So when you're, like you said, you'll designate an individual as to who's responsible for this recommendation is to handle it. I mean, some of these recommendations have been on the list for a long time. Are they being worked? Are they being ignored sometimes? Or why aren't these recommendations being implemented if we're really trying to make change?
It really varies. About 85 to 90% of the recommendations we make are closed within a year. And just with respect to the recommendations, while we can't require them to implement them, what we do when we make the recommendation is we ask VA if they're going to concur in it. VA concurs with almost all of our recommendations. We then ask them for an action plan. How are you going to implement it? So VA commits to the action plan, including the date when they think they'll be finished with it. So that gives us a structure to follow through. It's still VA's decision to do it. We can't require them, but by having an action plan, we can watch closely what they're doing.
But as you're going along, and like if a plan, well, let me ask you this. How often is a recommendation that you make where they say, we're not going to do this?
It's very rare. I think we've had a handful in the last few years.
All right. So they are working on all these recommendations that you're saying, but when something's taking 29 years, I mean, what is the root cause of that? Is it really coming back down to management again?
It's a few that are open more than 5 years, and they are correct. It's typically a staffing issue, or we get the sense it's not their priority. But if we see recommendations that are open for a long time that we think really need to be closed out, I don't hesitate to escalate it. For instance, if it's at a mid-level person, I will escalate it at VA. And I typically get a very positive reaction when I bring it up to explain that VA's committed to doing it, we think it's important, and it needs to have the right attention.
And one last question for Mr. Dodaro, and you could probably give us this one for the record because I'm running out of time, but there's always going to be turnover. We know that there's always, with each new administration, there's going to be a new secretary, there's going to be new assistant secretaries, but you talk about this, you talked about the weakness in management there at the VA. Is it at the bureaucratic level, or do we not have sustained professional managers there at the VA that can manage the day-to-day operations there? And I'm out of time, so if you could just submit that for the record, I'd appreciate that.
I will do that.
Thank you. I yield back my time.
Thank you, Mr. Cisneros. I now recognize Mr. Bost for 5 minutes.
Thank you, Mr. Chairman. Mr. Darrow, I kind of want to go down that same path, and that's because a couple years ago, our office discovered, because we thought it was just the VA just adjacent to my district that was having this problem, but that was the fact that the management there at the individual VAs they had, I think, 6 or 7 temporary managers over a 6-year period, because there was a rule that you could not be assigned a temporary management position for more than 280 days. If you continue down that path, what you have is, I was in small business, I couldn't memorize the names of the people I was even working with in 280 days, let alone figure out what the problems were and then get them fixed. So we actually moved forward with the bill at that time to try to have them show us a plan where they would correct this problem. And what we also discovered was it wasn't just that VA. There were a total of about 20 we discovered that were in that same type situation. Have you noticed any change at all, and is that type of management problem you're talking about?
That's one of many. Yes, that's definitely one of them. You know, for example, I mean, you can have somebody operate in an acting position longer than 210 days under the Federal Vacancies Act, but they can't carry out non-delegable functions. But most of the functions are delegable and should be in place. But part of the problem here is that there are weaknesses at every level and lines of accountability. Sometimes you have at the medical center level, there's issues. The VISNs, there's not clear accountability. There's headquarters offices, and it's really not clear exactly what the line of accountability is. You know, what we find in the healthcare area, there, for example, there were 800 national policies, there were 55,000 local policies, and there was no alignment between the national policies and the local policies. If you don't have that, how are you going to train people to implement things? Nobody's really in charge. Now, what we've recommended in the past, and it may be something that this committee should consider, is there needs to be a chief management officer in certain positions, and I've recommended in the past that this person be given a term appointment. So they would be, you know, confirmed by the Congress. They wouldn't set policy, but they would make sure that the management infrastructure is there to work properly to implement whatever policy that whatever administration is would go forward. We've successfully had that installed at the Department of Defense now. There's a position like that at the Department of Homeland Security. There's not really a management integration function at the VA right now, which I think is something that needs to be remedied. We have not been able to be succeeded, though, in getting term positions. But some positions in the government, like the Commissioner of the Internal Revenue Service, Social Security Administration, FAA, they have 5-year terms that could be renewed for 5 years, and that has helped provide more management stability at those 3 entities. So I think this is something that the committee should consider. I'd be happy to work with the committee on these type of structural changes.
One more question I have, and either one of you could possibly answer this, but another thing we discovered also is that there's not a set standard for certain jobs. And I'm going to give the one example. One of our VAs, it was a personnel officer. There was no requirement of an education level. There was no requirement of anything, of past experience in the field. But then when we ask the VA about this, I mean, obviously if you're hiring a doctor, you're going to get a doctor. But when in the position of management, there are no set standards or criteria that are met, and I think that's one of the problems why when we use the term when you visit one VA, you visited one VA, because we had in this case a very inexperienced person in charge of personnel, and because of that you got a lot of unique hires, to say.
I would say, and I know Mr. Missel wants to add, so I'll be very brief on this. I would say, you know, VA is a large decentralized organization, but it only works because of individual actions at levels. There's not a system in place that ensures these things are dealt with in a uniform manner on almost any issue.
Well, thank you. Time's up. I'll yield back.
Thank you. Mr. Rose is now recognized for 5 minutes.
Mr. Mizzle? All right, I'm always very respectful of. I have a name that no one ever messes up. So, I want to talk very briefly about staff vacancies. You know, we have noted in the past top 5 shortages being psychiatrists, human resource professionals, primary care providers, psychologists, and med techs. Do you find right now that there is enough of a sense of urgency, that there's enough resourcing around this? What is your perception of the ongoing work in this area?
I think it's due to a variety of reasons. So we do a staffing report on a yearly basis pursuant to congressional mandate. And what we do is we actually survey the medical centers and say, tell us what your priorities are, where your important vacancies are. As you correctly point out, psychiatrist was mentioned, I believe it was by 83 out of the 141 medical centers. And when you think of suicide as being the #1 clinical priority, psychiatrists play such an important role. Number 2 is HR. How can they hire people if their HR function isn't fully staffed? We found a significant problem in our report on the Washington, D.C. Medical Center, where there were vacancies in many of the support areas that ensure quality health care, like sterilization, like housekeeping to clean rooms.
Right.
And they had a deficient HR.
What's interesting to me, though, is that we were sitting down with a 4-star general. They never complain about the absence of colonels, right? Because they grow them themselves. Do you think that it's time for the VA to start to consider ways in which we can actually, God forbid, in this town, we think long-term and build a pipeline of medical professionals? Is it time to start thinking about that?
One of our recommendations on the staffing plan is for them to build staffing models to do precisely what you're talking about.
What about a training model, though? What about starting to pay for people's education and with a guaranteed time of service required on the back end?
VA has some of those programs. They do have it for physicians and other positions as well.
I'm talking about dramatically expanding it. Is there something that we can do to guarantee a pipeline? Again, I've never heard a 4-star or 2-star or whatever complaint. Man, I don't have enough majors.
Well, we made a number of recommendations on how they can improve staffing. It's frustrating they haven't implemented all of those because, to me, staffing is one of the core functions of an organization.
I agree.
And if you can't get that right, it's hard to get the other things.
I agree. Well, I know that Chairman Pappas, that's something that we would love to think about. Mr. Dodaro, you mentioned earlier that Congress needs to continue to assert its role in this. How, in the absence of the fact that the VA is not even showing up right now, the secretary or a designee, leads me to believe that they don't care that much. Is it possible to have progression reports? Are there things? What is your recommendation for how, beyond oversight hearings, what can we do as a committee to highlight the absence of any progress or not suitable progress on this matter, and to push or shame or impel the VA leadership to do something?
Yes, and in the past, what I've recommended Congress has done is on several issues, they'll ask for quarterly reports from the agencies.
And can so your recommendation is to legislatively mandate quarterly reports?
Well, if they're not coming to the hearings, I mean, you need to get the information.
And we can do that.
You have the power to purse, both in the appropriation process as well as authorization. You can compel them to provide regular reports.
What are examples where there has been mandated quarterly reports in other departments?
At the IRS, for example. I think you're going to really need it in the electronic healthcare record area.
I agree.
I mean, the IRS tried the big bang and the long-term effort on tax system modernization, and that didn't work well. You need incremental reports on, you're talking about anywhere from $10 to $16 billion program over a 10-year period of time. I mean, to be implemented, you need incremental reports. It could be done on, you could have them report on how well they're responding to GAO and IG recommendations, how well they're dealing with the high-risk areas. You can have them do that. Now they'll complain that's onerous and whatever, but you need to get the information, and particularly if they're not appearing at hearings, that's a way to get it.
That's very helpful.
Yeah, and there's also, through the appropriation process, there's also what we've worked with the Congress on in the past is fencing some of the money. In other words, like on some of these IT systems, okay, you can only spend so much, and actually there are quarterly reports that are required in some agencies before they can spend the money to go into the next tranche on IT.
Cash and shame.
Yes.
Passion shame.
Yeah, I would also say, if I might, on the graduate medical education area, the government spends about $16 billion a year right now on these to pay for graduate medical education for doctors, both at VA and DOD as well. And the part of the issue that we've identified, though, is that they've never evaluated the success of those programs. And if they could evaluate those programs, I think there would be a basis for supporting what you're suggesting.
Just to close out, I mean, it seems that there's a crisis with staffing in the VA, but not a crisis in staffing at DOD healthcare facilities. And I'm curious as to why that is when everyone's just trying to take care of soldiers or vets.
Yeah.
So we should look at that.
Yeah, one thing we could do is look at the two programs and compare them.
That's great. Thank you.
Thank you, Mr. Rose. I now recognize Ms. Radewagen for 5 minutes.
Thank you, Mr. Chairman and Ranking Member. I want to welcome the panel. So my question is, the latest addition to the high-risk list, VA acquisition management. Could you please describe how this area was identified for the high-risk list?
Yes. We had been asked by the Congress to look at the functions that have been put in place, particularly the surgical and medical procurement strategy they had in place. VA was hoping to achieve about $150 million of savings. And we went in and found that they didn't really involve the clinicians in the development of that process. It was expected that 40% of all the procurements would be made off of their master list on that area, but that was only about 20%. So they weren't achieving the savings. We found they were still using a lot of emergency purchases rather than go through a competitive process and have a better system. The regulations hadn't been updated since 2008. They've been working on an update since 2011. And we talked to the people who were the contracting officers. They felt their workload was excessive, and they weren't getting training necessary to implement it. So there was a range of issues. We did a number of audits, and that led us to the conclusion that there was a systemic problem here that needed to be addressed.
Okay. So also, it stands to reason that VA would close the easiest recommendations first. So if we're talking about moving the needle in terms of closing recommendations with the greatest impact to solving the overarching problem, where would you, and it's a bit subjective, where would you say VA stands today?
VA closes anywhere between, or we close. So we don't close a recommendation unless we get confidence that the solution that VA has agreed to is going to be sustainable. They close 85 to 90% of the recommendations we make within a year. And so we watch it very carefully. We monitor what they're doing. We test it. We require everything in writing before we close out a recommendation. And to make sure they're effective, it's really our responsibility to come up with recommendations that get to the root cause of the issue. Because when we do a report, we not only identify what went wrong, but why it went wrong. And our recommendations really got to focus on the fact that we want to address the issue, make sure it doesn't happen again, and that other VA facilities or programs that may have similar issues can learn from that as well.
Thank you, Mr. Chairman.
Yeah, I would say from my standpoint, they're doing a pretty good job of implementing our recommendations, working hard to do that. They're not doing such a good job in addressing the underlying root causes for the problems. And unless they do that, they'll fix a set of recommendations and we'll make a whole new set of recommendations, and we'll get into that kind of pattern. So I think the addressing the underlying management weaknesses has to be done in order for all of us to say that our government has the very best management operation at the VA to serve veterans.
Thank you both. Thank you, Mr. Chairman. Yield back.
Thank you, Ms. Radewagen. If the witnesses will oblige, General Bergman and I just want to take a few more minutes to get in a couple more questions. And I wanted to just follow up on a question that Chairman Takano referenced. He asked about the VA Office of Suicide Prevention. And Mr. Missel and Mr. Dodaro, is your office currently conducting any audits or examinations of any of the VA's suicide prevention programs?
Yes, we have a number of active projects going on right now. We have approximately 4 to 5 on individual suicides, including the one in the West Palm Beach Medical Facility where a veteran was in inpatient mental health and while there committed suicide. And we're also exploring other areas as well because of the critical importance of this issue and the tragedy of the issue. We're expanding out to look at broader programs with respect to suicide. And as I previously said, with respect to the VCL, we went out recently, again, to review that. That touches about 750,000 contacts a year.
Thank you.
Yes, we are, at the request of Chairman Takano, looking at the pattern that's emerged recently of veterans committing suicide on VA campuses and what is perhaps behind that issue.
Well, thank you. I know the entire committee looks forward to working with you on these matters. Just want to call out one thing that Secretary Wilkie provided in his testimony. He said, quote, "The department is currently working on establishing process to create functionality within the Office of Accountability and Whistleblower Protection, which would both track and confirm implementation of recommendations of both the GAO and the IG. Congress established the statutory requirement 2 years ago. However, the Secretary did not provide a target deadline following that particular law. And so I just wanted to make it clear that we'll be following up with the department on the timeline for ensuring that there's a clear and effective process to ensure implementation of that. One final thing, and Congressman Rose had asked a bit about what can Congress do to ensure action on these recommendations. And one thing I wanted to ask you both, if there's anything the committee should be looking into to consider how we can empower you both and both of your agencies to do your job even better.
I think having hearings like this and shining the spotlight on the issue is one great way to do that. We publish semi-annually the number of recommendations that have been outstanding for more than a year with giving details. So we provide that information. We try to put as much transparency on our work as possible. And given the importance of recommendations, we feel that we can't do enough with respect to that.
One of the things I was pleased to see last year, the Congress passed the GAO-IG legislation that will, in future years, require agencies as part of their annual budget submission to the Congress to identify actions they're taking to implement open GAO recommendations. So there'll be a systemic process to do that. In the interim, you could ask every year, I send a letter to each department and agency head outlining the highest priority recommendations from our standpoint. You could ask what they're doing to implement those recommendations, to have them report to you on that, and we can help critique that submission. Other reports, but I agree with Mr. Missel that the most effective tool of the Congress is to have hearings and to have people come up. You know, the action that occurs just because Congress holds a hearing has a cathartic effect on the agencies and prompts them to make actions. And I've seen this not just the VA, it's across the government.
Thank you. General Bergman, you're recognized for 5 minutes.
Thank you, Mr. Chairman. And on the subject of oversight of the electronic health record modernization, I was a proud co-sponsor of the Veterans EHR Modernization Oversight Act, which was enacted last December and is one of the toughest pieces of reporting legislation to ever come out of this committee. So we know we have our work cut out for us on that, but we're going to be like a dog on a bone on that one. Now, this question is for both of you. The Accountability and Whistleblower Protection Act, which I referenced earlier, of 2017, established the Office of Accountability and Whistleblower Protection and tasked it with recording, tracking, reviewing, and confirming implementation of recommendations from GAO and the IG. From each of your organization's perspective, what are practices that OAWP could build into their policies and procedures that could help VA address recommendations and improve services?
We meet regularly with OAWP to talk about how they're going to be implementing a number of their policies that they have not done so yet. I have a regular meeting with Dr. Bonzanto to do so. I know this is one area where they're working hard to try to implement it, to get it off the ground. From our perspective, we coordinate from the OIG all of the recommendations from VA. But VA doesn't do the same thing. If it's a VHA recommendation, it goes to VHA. If it's VBA, VBA deals with it. If it's Office of Information and Technology, they take it. So I think having a policy where VA has the reservoir of all of the recommendations, I think it will get greater attention, certainly from the most senior leaders of VA, if they're all there. So they really need to put that together to have a better indication of the number, types, and extent of recommendations that they have.
I agree with Mr. Missile on that. That's a very good suggestion and a good potential outcome. The head of that office came to visit with me, and I pledged to work with them, to coordinate with them on their responsibilities. I still think the department's working out exactly how this is going to operate because we're basically still operating as we've had in the past, dealing with, as I mentioned earlier, the Office of Congressional Liaison and other things. And so until we hear further from them how they're going to work their internal coordination on the GAO recommendations, it's pretty much status quo. But whatever they work out internally, I can pledge that we will work with them to make sure it's in our benefit and everybody's benefit that our recommendations be implemented.
Okay. And one final question. You know, in the military, we routinely change commanders because you don't command a unit forever. You're there for a while, you move on. But one of the things that we have is we have turnovers, whether it be in the form of a brief face-to-face, whether it be in the form of a folder or a binder or some record of what that unit is doing, where they've made their gains, where they have their challenges, et cetera, et cetera. Is there, and we talk about sustained leadership within the different levels of the VA, do you sense, is there any corporate knowledge, if you will, that is passed along when someone is leaving a position of leadership and someone new coming in? Is there a pass down?
Again, it's going to depend on the situation, but if I could just generalize, I don't think they do as good a job as they can. There's been an extraordinary number of senior leaders who've turned over, and I don't just mean at the very top, but at program offices, et cetera, and they don't frequently have a good sense of the history, what's the priorities had been, and it takes them a long time to get up to speed. And given all the critical issues facing VA now, that really does hamper implementing it. And that's why when we look at continuity of leadership, we think that's a really critical and important issue that VA just needs to get better at.
Yeah. I really don't know whether they do that or not, but I do know that if they do, it's not evident.
Okay, well, thank you very much, Mr. Chairman. I yield back.
Thank you. I recognize Ms. Radewagen for 5 minutes.
Thank you, Mr. Chairman. One last question here. DoD supply chain management was removed from the high-risk list this year. Could you please share how that came around, what type of engagement GAO had with DoD to get off the list, and lessons learned from that engagement? And as a follow-up, would you please also explain what, if any, best practices from that successful removal are now being applied to VA offices on the high-risk list?
Yes. The DoD supply chain management was one of the charter members of the high-risk list when we created it in 1990. So that was the one that's been on there 29 years. And for many years, DoD ignored our recommendations and didn't make any movement until Congress required them to develop plans in inventory management and to report to the Congress. Then they saw the benefit of those plans, and it turned into the plans on asset visibility and materiel distribution. And as a result, they've saved millions of dollars, and they have a better system now to get the materials to the military at the right place, in the right time, and the right amounts. So that was a very good example of how Congress was the catalyst in that case. Then once DOD started implementing our recommendations and seeing the value of it, then it took over from there, and we had a very constructive working relationship with them. But it took too long. I mean, that could have been handled a long time ago, and I'm hoping at VA we can take the lessons learned and help it to be a faster process. But so far, we don't have the plans. It's still lacking the plans that were lacking at DOD when we first put the area on the high-risk list. And so until they have those plans and their reports against those plans, you're not going to see any material change in our ratings.
Thank you, Mr. Chairman. Yield back.
Well, thank you very much. Before closing today's hearing, I just want to make a couple of final points first. I know General Bergman and I share the same outlook that we are really committed to ensuring that the work of this subcommittee remains bipartisan, that there may be points in time where members disagree with one another, but we certainly have to move past the point where we're disagreeable and focus on the job that we're here to do. And I know that all the members of this subcommittee share that outlook. I really want to thank our two witnesses as well for being with us here today. I want to express, real great appreciation to both Comptroller Dodaro and General Missel for their ongoing oversight work of the Department of Veterans Affairs. The audits, the inspections, the examinations, and the reviews provide critical facts, analysis, and recommendations for the Department, for Congress certainly, and ultimately for the general public. And please also relay to your staff, our thanks for the incredible work that they do. As was shown today, the impact on both the GAO and the Office of the Inspector General results in very real improvements to the Department of Veterans Affairs, and our veterans ultimately are better served because of the work that they do and that you do. General Bergman, I'm happy to recognize you if you'd like to close.
Well said, Mr. Chairman. Time is finite.
Thank you. Members will have 5 legislative days to revise and extend their remarks and include extraneous material, and without objection, the subcommittee stands adjourned.